Next, we are heading to S.V. Parameshwarji Memorial Lecture. I would like to invite Professor Mohan Kundumal, Vice Chancellor, University of Kerala, to deliver the lecture.
Dr. Kundumal's list of achievements features like Best Doctor in State Award in 2016 from the Government of Kerala, the IMA Community Service Award for Individuals in 2012, Dr. P.J. Alexander Memorial Oration Award from Kerala. At the national level, he serves as the president of the Association of Indian Health Science Universities. During the COVID-19 pandemic, his expertise was highly valued as a special invitee. Dr. Kundumal has also guided 19 research projects focused on healthcare significance and has several national and international publications. Once again, I would like to welcome Dr. Mohan Kundumal. I also invite Dr. Chandrabose Narayanan to chair the session.
Good afternoon. Let me at the outset thank the organizers of this wonderful program for giving me an opportunity to interact with the eminent faculty as well as the students of Central University. Thank you. And it's my honor to talk in the name of Sri P. Parameshwaran, the Maha Rishi. We are all fortunate to live with. I had the fortune. I had the fortune to meet him, talk to him, and such an Rishi lived when we were also living. He's a multidisciplinary personality. He was an RSS pracharak, a philosopher, a thinker, author of innumerable books, a poet, a builder of character who dedicated 70 continuous years of his life for nation building. He is the founder director of Bharatiya Vichara Kendra, which is a think tank in the country. And his vision as a Vikasit Bharat is rooted in indigenous values and spiritual strength. In 1995, Parameshwarji was elected as the president of Vivekananda Kendra, Kanyakumari, and he made it what it is now. He took initiative to propagate Bhagavad Gita through Gita Swadhyaya Samitis in Kerala, and now during the month of Karkadaga, we are celebrating Ramayana month, and the man who is responsible for that is Parameshwarji. And he was, of course, the thankful nation honored him with Padma Shri and Padma Vibhushan. You can see the Prime Minister and President bowing in front of this great Rishi. And this is the quotation which I would like to use. The youth of Bharat are not merely inheritors of our civilization, but the architects who will shape our nation's future glory. And actually, they are shaping the glory, and that's how we are marching to Vikasit Bharat. Now, the focus of my oration will be to bridge the gap between philosophical foundations and modern healthcare strategies, and defining the role of academia and health science universities in achieving 2047 vision. And the key pillars of Vision Vikasit Bharat, it's in the youth. Largest number of youth in the world is with us. And the garib, the poor, there should not be any poor. That is what we want. And Mahilayam. And the strength of any family, strength of any country is the women. And that's why the Central University is very strong. 70% of the students are women. So it's the strength, it is future. And Annadada, the farmers. Now, how are you going to become Vikasit Bharat? Targeting 30 trillion to 35 trillion economy. So per capita income 2,500 to 15,000, 2,500 today to 15,000 to $18,000. But economic growth is unsustainable without healthy, productive workforce. And that's what VK Paul of Niti Aayog says. Swasth Bharat is the foundation of Vikasit Bharat. Actually, we have to a transition from a reactive to proactive society. When somebody gets a disease, you immediately treat. Actually, we have to be proactive and disease-free society, Niramaya society. That is what we are aiming. And we must move towards holistic healthcare ecosystem. It's not a provider center. I have a hospital, so you come here. It is not that. A patient needs a solution, so his solution problem has to be solved. Ensuring universal access to high quality care regardless of geography, whichever part of the country you are living, and whatever is your income. And we always say about GDP increasing. Actually, we have to discuss about HDI, Human Development Index, moving beyond GDP to encompass health, education, and quality life, as the governor has been saying. So we have to focus on that. And we target our life expectancy by 2047 to 85 or more. Let us see what was India's position in 1947. Lowest life expectancy, lowest in the world. Infectious disease like malaria, smallpox, cholera, any other disease, you name it, it was there. And what were the data? A life expectancy of an average Indian at 47 was just 32 years. Just 32 years. And Kerala, of course, was a little higher, 40 to 43, and world was much more higher. And infant mortality, again, Kerala is better, but Indian data is not happy. And what is today's data? Life expectancy, it has increased to 71 for India, but Kerala, of course, it's advanced 78, and world is around 73. And infant mortality, wonderfully well, Kerala is just 6, but India also has progressed to 27 and on the world level. And maternal mortality, of course, Kerala is again advanced. Now, what are the issues currently we are facing? We say that we have controlled infectious disease much better way, but lifestyle diseases like diabetes, hypertension, and all these things are becoming a big problem. And in Kerala, we have a unique problem of advanced age. In fact, you can see in houses where there is a 100-year-old man looked after by his son who is 70-year-old, and who is supposed to be looked after by a 35-year-old man who is incidentally is in USA. So this is a Kerala paradox. This is a real Kerala paradox. And what are we hoping in 2047? We are hoping that Keralite will live up to 82, 85, and the rest of India will lag behind 77 to 80, and it's at the world level. And infant mortality, we are going to achieve amazing level of less than 3, the best in the world. And India, of course, will turn. And the focus will be on geriatrics, universal insurance, personalized genomics. Now, some actual data, let us see. The out-of-pocket expenditure of an average Indian has readily fallen from 64% which was in 2013-14 to 39.4. It has reduced. It reflects accessibility and affordability of public services. Public services have improved in a big way. And how it has improved? The government of India's health expenditure has increased from 1.13% of the GDP to 1.84, almost 50% increase GDP has increased, and that is reflected in the out-of-pocket expenditure of a Aam Aadmi. But in 2047, what is the vision? You need 3 million more hospital beds. You need 5 million doctors more to meet the globalized standard. As on today, most of the community health centers are having 80% vacancies. Now, it is not doctors, it is not hospitals that is going to help the health. It is water, pure water, safe water. And Jal Jeevan Mission, the community-based approach to provide safe, it is actually doing a Jan Andolan of water. This is doing an amazing thing in the entire country, rural and urban areas. And food. National Food Security Nutrition Mission by Government of India, it ensures that each and every person gets sufficient food. When I was a medical student, in the hospitals, in the pediatric ward, we had a separate ward for malnutrition. We had a marasmus child, kwashiorkor child, and we were treating them. No, there is no such ward. There is no malnourished child. In fact, you have overnourished children, obese children. So that is another malnutrition. So this has been taken care by the Atma Nirbharta in pulses, PM Dhan Dhanya Krishi Yojana, and the National Food Security Act. It's a very important act, and PMJKY, it ensures subsidized food for 81 crore population. 81 crore population in the country. Nowhere in the world this is getting. And the entire America has got 37 crore population. And that 81 crore people are getting free food, subsidized food. And food security is digitally monitored. So it is ensured that a mobile app for the beneficiaries, it is made sure that each and every person gets what they need. And as Anandra was saying, rice may not be the safest food. It will give you diabetes. And what is the alternative? Millets. And Government of India celebrated the International Year of Millets in 2023. In fact, millets was the real thing which was grown in India many, many years ago. Then rice came. And millets does not need much water to grow. And its glycemic index is very low. And persons with diabetes, this is the safest food. And now, hospital. And research also in the Ayush area, there are all-day institutes have come up, and a lot of research projects and a lot of funding also has come to Ayush. Now, coming to pharmaceuticals, today India is called the pharmacy of the world. 50% of the generic drugs which are sold in USA and 40% of the generic drugs sold in UK is made in India. Many of us don't realize that. We make largest quantity of drugs. But the pharmaceutical ingredients, we don't make that much. That's why that is the focus we are doing. And the projected value by 2025 is 638 billion, and it has to increase further to 350 billion by 2047. That is the expectation of the pharmaceutical industries and government, and it is definitely likely to happen. And research, definitely huge research clusters are coming up all around the country. And now we are discussing about individual medicine. Each person will have the same drug may act differently in different persons. Suppose I am hypertensive, certain specific drug will act on me and certain specific drug will act on another person. And this is based on my genomic structure. And now we know the genomic structure. 10,000 whole genomic to build a national database has been created. Now individuals' genetic data is known, and so that the treatment can be personalized. Now AI, of course, being a radiologist, I know how AI is going to influence the entire medical scene. Instead of my reading the X-ray, the AI machine will read the X-ray. Of course, I will read much better than that. That's a different issue. So, but people won't agree. So, Aldi Institute of Medical Sciences has started a AI radiology reporting system. It has come. So, all these things are coming up in a big way. Now, under Kerala University of Health Sciences, we are giving a huge focus for Ayurveda. There is a school of fundamental research in Ayurveda at Tripunithura in Kerala, and a lot of research is going on there. And this is our Ayurveda Research Center, School of Fundamental Research in Ayurveda. And in order to initiate research among the undergraduates, usually we tell about postgraduate research, usually we tell about the PhD research, but we have introduced a scholarship scheme for undergraduates, rupees 10,000 for 1,000 students, 1,000 scholarships, probably one of the earliest, first initiative in any of the universities in the country. 1,000 scholarships are given to undergraduate students. And they are just initiating and creating a culture of research and innovation cells are this thing. Youth, definitely we have to invest. They will shape our nation's future, and therefore students are encouraged to submit innovative ideas through Vikasit Bharat portal. So coming to my conclusion, roadmap to 2047, the strategic pillars are robust infrastructure, digitalized care, and it should be innovative. Quoting Parameshwarji, nation should be above self. And for a Swasth, Niramaya and Vikasit Bharat by 2047. Thank you.
Any questions specifically on this presentation? I will, earlier we couldn't introduce Professor Chandrabas Narayan. He was the director of BRIC earlier. Now he has moved to BRIC Trivandrum, that is Rajiv Gandhi Center for Biotechnology Trivandrum. In his span there, he has created one of the world's best campuses. It's not comparable. It's comparable to any world-class facility for doing research in biotechnology. So I will urge all the students to visit that campus whenever you get time. We will be able to organize that. And let's hear from Dr. Chandrabas Narayan on the subject as well as anything else he would like to speak. Please, sir.
Thank you. It was a surprise for me to be called in to chair this session. Of course, Professor Mohanan Kundamel is a close friend for past 3-4 years. We have been together handling health sciences in Kerala. And I had a great opportunity to work with him, though he is in a role in Trivandrum as the Vice Chancellor of Kerala University. But coming from a medical fraternity, we have been discussing about what India should do and what Kerala should be doing in medical sciences. And what Mohanan Kundamel has mentioned is very, very important. And there is a lot of policy as well as initiatives which have been taken up in healthcare. But one of the things which I want probably Professor Mohanan Kundamel and his fraternity to take up is there is a lack of research in medical fraternity, which he had actually mentioned during his talk. And this is because there is no direct involvement of health practitioners, clinicians working with academicians. So my since you have started, and it's a great initiative that at undergraduate and postgraduate level, there is a scholarship which is being done. If this can be augmented with his influence in the government, if it can be done in an academic setup like say a Rajiv Gandhi Center or a NIIST or Kerala University or various other universities, because one of the things which is missing in medical fraternity is the lack of knowledge in the biochemistry, cell biology and microbiology, which is missing in the teaching of medical practitioners. And that would come up if you can actually encourage the UG and PG students to take it up. That is one request I have from the knowledge which we have from our academic fraternity. So that is one thing. But the greatest thing which is happening is that there is a huge change in the healthcare sector which is happening, and I hope the academic fraternity would work with them to actually envisage a very healthy Indian population. Today, more than ever, we are actually now having a problem of geriatric care. And old age is one of the things which he touched upon. I think we need to actually worry about the old age. Prevention of the problems which you would encounter as you grow older and older. The more older the population is getting, the lesser, the more chances of getting a non-communicable disease is higher now. I am sure that Professor Kundumel actually agrees with me on that aspect. And today, the research has to be in aging problems. And that is missing today in Indian fraternity, academic research in Indian fraternity, and that would be a great service to the nation if we start working on that area. With that, I would like to request all of you to give a very loud applause for wonderfully presenting the healthcare scenario in India. Thank you.
In fact, Dr. Mohan Kundumel has given us what is Viksit Bharat, how to reach there in terms of medical sciences. He has shown with figures the gap where we should be in 2047. And let us give a big round of applause to Mohan Kundumel, sir. And I request Dr. Chandrabhas Narayan to hand over the memento. Thank you very much, sir. Thank you.